today on the Frontline Health Podcast.
That we all are looking for causes, because if we know the cause, we can usually cut it out and it'll never happen again. But in this case, there's so many different factors that come into play. It's really, really hard to tell which one is the leading cause, but it may be, death by 1,000 cuts. You've got so many different things going on that one of them by itself may not cause it, but when you have 15 to 20 to 30 things all compounding, that may be the ultimate cause. So, always a good thing to jump in there, but understand that one piece, like you said, may not be the total cause, but let's go ahead and take it out of our lifestyles anyway if we can.
Hello and welcome back to another episode of the Frontline Health Podcast by Centurion, where we share health news, tips, and insights to help you take ownership of your health and your life. My name is Evan Patrick. With me is our founder and CEO, Troy Duell, and we're coming at you with another episode of Health Headline Highlights.
Yeah, excited about this month's episode and some of the highlights we were able to find. This first one really jumped out to me because it's something we've talked about in the past and even seen other health headlines. It says exposure to common chemical in plastics is tied to heart disease deaths. So what they found was they did a study on DEHP, which is a chemical used in plastics, typically saran wrap and other plastics like that. And they found potential linkage to over 13% of global heart disease deaths in 2018, especially for people between the ages of 55 and 64. DEHP is a phthalate, and it's often found in that medical tubing and plastic wrap as well as PVC products. But it was interesting because this study was posted in the Lancet, and they used international health and environmental data from 200 different countries. They found what they feel like were 350,000 heart disease deaths, but they also found in kids the exposure was linked to developmental issues, specifically lower cognitive function and ADHD, which is interesting because we've seen a growth in all of those things. And in adults, it wasn't just the cardiovascular disease, it was also some reproductive problems, obesity, type 2 diabetes, and even some hormone-related cancers. So, interesting article.
Yeah, and it's clear that in a wide variety of ways, not just cardiovascular issues, these microplastics are bad for us. So, and specifically related to DEHP, what can we do to limit our risk of exposure?
Based on this article, they said, first, don't take it, and they didn't say don't take it as gospel, but they said use some caution because it doesn't necessarily mean that it's a direct link. In other words, there could be a lot of other causes in there, but this is one of many causes that could be a part of this problem. Second, we should really start avoiding labels or avoiding plastics that are labeled with recycling code number 3, which is PVC. We should start using glass as our food storage, or stainless steel as our food storage. And I know you're big on that and have seen your glass
I've jumped on the train.
Around. Oh, yeah. That's one big way to do it. Third is really choose those healthcare items or any other items that are phthalate free, so they don't have any phthalate in them, and then limit your processed and packaged foods, because a lot of times the packaging itself may have phthalates in it, or they may put it in the packaged foods themselves. And finally, they're really pushing for some kind of policy change on the government level in order to try to reduce that exposure to the population itself.
Yeah. I think we're all better off if we avoid processed foods, not just for the plastic, but for all of the other things that are coming out that are in these things that are marketed as food, but are really
very true.
Contain things that we wouldn't normally eat or want to eat. Our second health headline highlight for today reads the NIH and CMS to study autism using Medicare and Medicaid data. This is the fact that this is going on, this deep dive into autism, whether it's coming from the NIH and CMS or from Bobby Kennedy, it has caused some strong reactions from all different people with all kinds of different opinions. The National Institutes of Health and the Centers for Medicare and Medicaid Services announced a partnership to build a secure real-world data platform using existing Medicare and Medicaid data. And the goal is to uncover the root causes of autism spectrum disorder and other chronic conditions. This initiative was officially announced on May the 7th. And the initial efforts are going to target individuals who've been diagnosed with autism, aiming to understand diagnosis trends, treatment outcomes, disparities in care, and financial impacts. Longer term, the platform will support broader chronic disease research and inform public health decisions to improve outcomes and transparency. I think one of the big things that people want to know with this, Troy, is are we just seeing an increase in diagnoses with autism because it's being diagnosed more because we have broadened our definition, or are there actually factors that are playing into a real increase in the number of children who are being diagnosed with autism?
That's a great question, and I hope that by doing this and kind of opening up the data that's there, that we'll get a better understanding of what's taking place. I have a feeling it's probably a little bit of both. I think we are certainly more educated, we're more in tune with some of those things, but we're also seeing a lot more cases of it, and I think that's easy to see when you just talk about the school population or anybody who has kids. You know, we didn't know anybody growing up who had autism or anything like that, but now as adults we certainly have seen that. Our kids know lots of people who have had autism or who have autism. So I think it's certainly becoming more prevalent, and it'd be great to finally come to a place of, okay, here may be some cause and effect of what's happening in order to cause this increase in autism amongst our kids.
Are you optimistic that we'll uncover significant data about the root causes behind autism from this study?
I think it's certainly going to help. The fact that we're even thinking about looking at it is a positive step, because in the past, I feel like the healthcare industry as a whole has really kind of put their head in the sand when it comes to this, and we've been more on the side of what can we do to help them get better if they have autism, instead of how can we prevent it altogether. And I think that prevention, I mean, Ben Franklin said it best, right? An ounce of prevention is greater than a pound of cure. So I think that's what we're looking for ultimately. So our next one is really kind of caught my attention. It says, rise in childhood thyroid cancer linked to artificial light and air pollution. That one kind of blew my mind. I was like, artificial light?
Yeah.
Really? I could understand the air pollution, but the artificial light one certainly made me stop and look at that headline. And the article goes on to say that childhood thyroid cancer rates have been rising steadily since 2006. They've increased about 3 to 5% annually, and there was a study done out of Yale that linked this rise to environmental exposures, specifically air pollution and artificial nighttime lighting. During the perinatal period, which is the time before birth to 1 year after birth, and they feel like it increased cancer risk by somewhere between 7 and 25% in those kids who were most exposed to the air pollution or the nighttime artificial light. They really emphasized that there were other environmental toxins that may be causing that. We already talked about one, the phthalates, the BPA, pesticides, heavy metals, because those are all what we know are endocrine disruptors, is what it talks about, and that those will actually compound the risk. But the article goes on to talk about survivors may face long-term side effects, not just from that, but they'll have secondary cancers, fatigue, and mental health issues.
Yeah, and studies like this really make you wonder, is this a case of correlation or causation? You think about what we know about what artificial light does to you in making your sleep quality poor. Is it the real issue behind this that children are not sleeping well, or they're not getting enough sleep? Or is it just a simple matter of if kids are staying up late at night, being exposed to artificial light from TV or video games, and they're not getting the sleep they need? Maybe they're not being given the best nutrition either, or maybe they're not being cared for in other ways if they're being allowed to stay up late at night playing video games or being exposed to artificial light in ways like that.
I think that's a great point, and something that we all are looking for causes, because if we know the cause, we can usually cut it out and it'll never happen again. But in this case, there's so many different factors that come into play. it's really, really hard to tell which one is the leading cause, but it may be, death by 1,000 cuts. You've got so many different things going on that one of them by itself may not cause it, but when you have 15 to 20 to 30 things all compounding, that may be the ultimate cause. So, always a good thing to jump in there, but understand that one piece, like you said, may not be the total cause, but let's go ahead and take it out of our lifestyles anyway if we can.
Our next health headline: how air pollution affects early brain development and what moms can do. Air pollution threatens early brain development. So research is showing that air pollution exposure during prenatal and early childhood periods can significantly disrupt brain development. A New Zealand longitudinal study linked early life pollution exposure to problems in cognition, behavior, and emotional regulation. And they found all kinds of mental health risks in children through this study, including attention issues from sustained exposure to air pollution, substance abuse linked to prenatal and childhood exposure, lower educational attainment, and conduct issues tied to preschool exposure. But we do know that there are some things that moms can do to help, specifically related to their nutrition, which can be a protective factor. So antioxidant-rich diets can help reduce the oxidative stress caused by pollution. Some of the foods that were recommended were berries, avocados and nuts, leafy greens, and Mediterranean diet we know is always good for us. And foods that support detoxification, such as your cruciferous vegetables like broccoli and kale. There are also a few other practical measures outside of just nutrition that were recommended, like monitoring air quality and limiting outdoor exposure during high pollution periods, using the N95 masks that we all know and love from the COVID-19 pandemic. But they can be used for higher filtration when you're in a high air pollution area, especially for pregnant women. And minimizing indoor pollution by removing harmful sources, improving ventilation, and using HEPA filters to clean indoor air.
Mm-hmm. Yeah, I think those HEPA filters are huge when you're talking about indoor air quality for sure. But again, it's interesting that this is the second article we had in the same month that talked about air pollution and having that effect on the mom and the baby while in utero. It's interesting how these all come out at one time and you kind of see them all happening. So you have to wonder, what was it that kind of sparked this? Because this was done in Australia, is that right?
New Zealand,
same thing. They talk the same.
They do.
But in New Zealand, were they working together in tandem with these two studies? But regardless, we know that air pollution is definitely an issue, and it's something that we need to think about, especially if you're a mom or wanting to be a mom, and making sure that you're having the best health possible. So we know that diet is huge, but great article. So thanks for sharing that. Our final one for this month is the title, Eggs, a Complete Protein That Supports Brain and Muscle Function. And we both thought this was great because I think you mentioned earlier that you're getting into kind of an egg fix and egg craze with your health piece. So some great information. And I actually have chickens at the house and we get our own eggs, which I love. But there were a couple of things that really stood out to me in particular. It says, for the brain, 1 egg per week may cut the Alzheimer's risk in half if you just have 1 egg per week.
If that's true, that's crazy.
It is absolutely insane. And they've really linked it to the fact that it's got choline in it. It also, which is huge for memory, but it also has lutein and zeaxanthin for your eye health. And then it's got the B12s and the omegas, which we've talked about a lot in regards to our brain health. The second thing that we know, if you eat 2 to 4 eggs weekly, it may reduce your risk of macular degeneration. And from a muscle standpoint, we know that eggs are going to help support muscle strength and help prevent muscle mass loss over time. There's studies that show it helps in weight management because it helps people feel full for a longer period of time, which we know keeps you from snacking when you don't want to. But these were the parts, since we raised chickens, that I really liked. It says eggshell color varies by breed and is linked to the hen earlobe color.
I always wondered what caused that.
Yeah, but I mean, I don't know if it causes it to be that way, but why is the earlobe color different, and then how it matches the egg? That's kind of interesting to me. The second fact that they had on eggs were egg yolks are among the largest single cells in nature, which I thought was very, very interesting. And the final piece is eggshells have 7,000 plus pores, which allows that air and moisture to exchange to help support the embryo development. So some interesting things. And the final piece on eggs, and then we'll move on, is it seems to be absorbed better when you pair it with other foods, in particular avocados. So that avocado toast that you have with eggs, perfect, because it's going to help absorb it and get those fat-soluble vitamins into your body. The leafy greens, so I always used to make fun of people who had spinach or some kind of green when they were eating their breakfast. I'm like, you can't do that with breakfast. But there is some actual data that shows that it improves the uptake of vitamin K and fiber. And then tomatoes, we know that if you eat it with eggs, that it's going to increase the absorption of lycopene. So some great fun facts for eggs for you there this week.
You rolling off that list of foods that enhance the nutrient uptake of eggs when you eat them together reminded me, have you seen those videos of the guys who have started eating off the cutting board, and every meal it's like 5 or 6 eggs, kiwi, and like beef?
Nice. I have not seen that. But, what I was a little disappointed that I didn't see was having the eggs with bacon. There's nothing that showed that bacon helps with absorption of any of that.
It's processed meat.
Yeah, but it's good. It is really good.
It is good. But my recommendation was going to be maybe we can start a trend where people are eating avocados, leafy greens, tomatoes, and eggs all together for a meal.
That's a great idea. That's called an omelet.
Well, there you go. Omelets have all kind of benefits for you. Thank you for listening to this episode of the Frontline Health Podcast by Centurion. As always, we encourage you, go out and take ownership of your health because you are your best health advocate. We'll see you next time. If you enjoyed what you heard today on the podcast, please consider leaving us a review. We would love to hear your feedback and connect with you further. You can also follow us on Instagram, X, TikTok, and YouTube. And for safe, effective, and affordable health and wellness products made in the USA, visit www.centurion.health. Thanks for listening. We'll see you next time.